Most Americans don't understand this, but in the midst of a disintegrating health care system, we have 60 million Americans who do not on a regular basis have access to a physician. 60 million. Now, what happens when those people get sick? Well, if you're in Vermont and you're kind of stubborn, you know what you do? You delay going to the doctor when you should go. And you wait and you wait. And 6 months after you first were feeling badly, you go crawling into the doctor's office and the doctor said, "Why weren't you in here 6 months ago?" And the person says, "Well, I was awkward. I felt awkward. I didn't have any health insurance. I was embarrassed. I didn't come in here." And the doctor says, "I'm getting you to the hospital right now because you're really sick." So instead of treating people when they are initially ill, what we end up doing for people who don't have access to a doctor on a regular basis or don't have any health insurance, we wait until they become very ill, and then we send them to the hospital, and we spend tens of thousands of dollars in some instances when we could have treated them with much less suffering and at much less cost. But, Mr. President, there's another point that is not widely known, and that is, according to the Institute of Medicine, in this country today, we lose about 18,000 Americans. 18,000 Americans every single year die because they don't go to the doctor when they should go to the doctor. 6 times the number of people who were killed on 9/11 every single year. So what Senator Dodd is talking about, and what many of us have worked on, is significantly expanding the federally qualified health center program started by Senator Kennedy 4 decades ago, widely supported in a bipartisan manner. And what studies tell us, if in fact we can do what is in this legislation and provide a community health center with physicians, with dentists, with low-cost prescription drugs, with mental health counseling, you know what we end up doing, amazingly enough? We save money. We save money. We invest over a 5-year period about $8 billion. We end up saving money because we keep people out of emergency rooms, we keep people out of hospitals, we keep people alive. If that's not a good investment, I don't know what is. So the fight to make sure that every American has access to a doctor, to a dentist, to low-cost prescription drugs is certainly, in my mind, one of the crowning achievements of the Health Education Labor Committee piece of health care reform. Mr. President, I just want to say a word. A month ago, I asked people on my email list, which is not only Vermont but all across the country, to just write to me and tell me their relationship, how they are dealing with private health insurance companies. Within a week, we had over 4,000 responses. Over 4,000 responses. And the booklet is available on my website, sanders.senate.gov, and I urge people to take a look at it, because if you want to know what is wrong with health care in America, this booklet will tell you, because people in their writing, from their own hearts, from their own suffering, are describing the health care crisis. And I just want to read and comment on a few of the statements that were sent into my office. This is from a fellow in Swanton, Vermont, a small town, northern part of the state. "My younger brother, a combat-decorated veteran in the Vietnam conflict, died 3 weeks after being diagnosed with colon cancer. He was laid off from his job and could not afford COBRA coverage. When he was in enough pain to see a doctor, it was too late. He left a wife and 2 teenage sons in the prime of his life at 50 years old. The attending doctor said that if he had only sought treatment earlier, he would still be alive." People talk about waiting lines in Canada or in Great Britain. Let's talk about over 18,000 Americans dying every year because either they don't have any health insurance, or if they do, they can't get access to a doctor. When we talk about the health care crisis in America, it's not just the pain that millions of Americans are experiencing, the fear, or the tens of millions of people who stay at their job today. You know why they're staying at their job? Not because they particularly want to stay at their job, but because they have good health insurance. Their wife has an illness that needs to be covered. Talk about economic nonsense, absurdity. Millions of people staying at work because they don't want to give up their health insurance. When President Obama says that because of the economic crisis we have got to address health care, he is absolutely right. Some of our friends on the other side say what they've always said. Let's do nothing. Well, you want to do nothing? Within 10 years, the amount of money you're paying from health care today will double. If you're a small business person today in Vermont or around the country, you're having a really hard time providing health care to your workers or maybe even to your own family. Think about what happens when the cost of health care doubles. Think about large corporations that have to compete with European, Scandinavian countries and companies where health care becomes a right of all people and not something placed on the employer. In this year, amazingly enough, when we talk about health care and economics, and Senator Whitehouse was alluding to this a moment ago, there are 1 million people this year, it is estimated, who will go bankrupt because of medically related illnesses. Most of those people have health insurance. 1 million Americans. And our friends say, well, we can't go forward. Now is not the time to go forward on health care reform. Tell that to the 1 million American families who have suffered bankruptcy. Mr. President, in my view, the evidence is overwhelming that our current system is extraordinarily wasteful and bureaucratic, that in a very significant way the function of our current health care system is not to provide quality health care to every man, woman, and child, but in fact to allow people within the industry, the private insurance companies, the drug companies, the medical device suppliers, to make as much money as they possibly can. Amazingly enough, according to the papers in the last few days, the health care industry has spent over $130 million in the last quarter on lobbying. I mean, they got 100 members of the United States Senate. You got 435 members of the House to spend $130 million. Now, where do they get that money? Well, they get that money, if they're a drug company, by charging the American people the highest prices in the entire world. I was the first member of Congress to take Americans over the Canadian border a number of years ago, where people, women who are fighting for their lives with breast cancer, were able to pick up breast cancer medicine at 1/10 the price. The drug companies can't lower prices in this country. They have to charge us the highest prices in the world, but somehow they do manage to come up with tens and tens of millions of dollars to try to buy members of the United States Congress. While more and more people are losing their health insurance, we're seeing many of the private insurance companies seeing huge increases in their profits. We're seeing the insurance companies, the drug companies, paying in some cases tens of millions of dollars in compensation packages to their CEOs. Mr. President, for anybody to suggest that this country does not need health care reform is simply not to understand what is going on from one end of this country to another. We are a great nation. There is no reason in the world why we should end up spending almost twice as much per person on health care as any other nation, and yet have inferior health care outcomes in terms of infant mortality, in terms of life expectancy, in terms of preventable deaths. We can do better. And right now, despite all of the lobbying money coming in from the health care industry, the moral imperative is for members of the Congress to think about the folks back home, the people who have no health insurance, the people who are underinsured, the people who are going bankrupt, the people who are staying at their work, not because they want to, but because they have a decent health insurance program, the small business people who can't invest in their company because they're busy spending all of their money on health care. We can do better than that. We must do better than that, and now is the time. So I would hope that the American people work with us in standing up to very, very powerful special interests and moving us toward real health care reform. Thank you, Mr. President. I would yield the floor.
Mr. President, I just want to briefly, before he leaves the floor, to commend my friend and colleague from Vermont. He has been